morning, everybody. On this week 2 of our Taking Action for Your Health campaign, we're focusing on breast cancer. All this week, Linda Hurtado has special reports on the latest technology and research findings. And if you miss any of them, they're all posted to abcactionnews.com. And joining us in the studio this morning, we want to welcome Dr. Christopher George, who is a medical oncologist with Florida Cancer Specialist. Welcome. Thank you for coming in.
Good morning. Thanks for having me.
So many folks see the pink, the ribbons, the walks, and they wonder, are we really making progress? How do you answer that question?
Well, this is a very exciting time in medical oncology and in cancer medicine in general because there's an explosion of progress with the newer aspects of genomic medicine and our ability to identify different types of cancer. We've now been able to structure the treatment more specifically for what's needed, and as a consequence, the success and survival has never been higher.
So it's not, the treatment isn't a one-size-fits-all. We hear the term personalized medicine a lot. What does that mean?
That's an important term. Again, 20 years ago, we thought of breast cancer as one thing, and now we recognize there are many different genetic subtypes of breast cancer, and this has allowed us to structure the treatment individually for that patient based on the exact subtype they have and in the specific mutations within their cancer.
So if a patient receives a diagnosis of breast cancer and they suddenly think of a friend or a relative who had a very negative, very bad outcome, that does not mean that their outcome will be the same.
Absolutely not. And in fact, most of the women now are going to be survivors. It has changed radically in the last 30 years, and in the last 15 years, we've seen a 50% reduction in mortality in breast cancer.
And what are you all seeing in terms of clinical trials?
So we have now many targeted drugs and newer forms of therapy which look at the specific mutations within a patient's cancer, and the clinical trials offer patients a chance to get at these new drugs based on the specific genomics of their cancer. So it's very important, and this is also how new drugs come about. We've just had 2 new drugs in breast cancer within the last 6 months, so it's very important for patients to consider trials when available.
So many great information. Thank you, Dr. George, for coming in. It's so nice to meet you.
Thank you very much for having me today.
And we have an exciting announcement as well. On March the 21st, join us for this year's big community event for our Taking Action for Your Health campaign. We're hosting a health expo at Westfield Citrus Park. It starts at 10 a.m. And our guest of honor will be Dr. Oz himself. That's right, we're bringing him to Tampa. The expo is free, and Dr. Oz will be joining us for a panel and to meet all of you for a question and answer session. We've posted all the details at abcactionnews.com/Dr. Oz Live.